This week on the BackTable podcast.
I looked at those men coming in and out, acting like masters of the universe. And I said, I can do that. I always liked science, but I thought I was going to be a social worker. So I walked out of that experience determined to become a doctor. Fortunately, I was just in the nick of time to change my focus and head to college, and knowing that I was going to medical school.
Welcome to BackTable Urology. My name is Claire Yang, and today we're meeting with someone as part of the Legends in Urology series. Dr. Carol Bennett, professor of urology at UCLA, is a pioneer and legend in urology. She did her urology residency at the University of Michigan, where she was the first African-American woman to train in their program. She then joined on as faculty as the first woman in urology faculty. In 1987, she became the first Black woman certified by the American Board of Urology. She relocated to Los Angeles and joined the faculty at USC in 1988, and then in 1996, went across town and joined the faculty at UCLA, where she again was the first woman on the urology faculty. In all of her faculty positions, she held the position of urology section chief at the hospitals where she practiced. Dr. Bennett is also known for her research in neuro-urology and is widely admired for her clinical acumen, teaching, and mentorship. She was recently named only the third Fourcroy Leadership Award recipient by the Society of Women in Urology, recognizing her decades-long career and exceptional leadership in urology. Dr. Bennett, welcome, and thank you so much for joining us. It is particularly notable that you're here today, given that you live in Los Angeles and there are terrible fires ongoing. I hope you and your family are doing well.
Thank you very much. Thank you for that kind introduction. We are doing well. Last week, this time, we weren't feeling as good as we feel now about the whole situation. It's getting better.
Great. Glad to hear it. We have a lot of friends down there too, and it's been very disconcerting for so many people. So to get started, you've had a long and successful career in urology. Let's start with, what are you doing these days?
I don't see patients anymore. I stopped seeing patients about 2 years ago. Now I do clinical work for the hospital's urology department. So I'm still part-time staff at UCLA. With my other time, I like to run or walk. I hike. I love to stay active, actually.
It'll keep you young.
That's not possible.
All righty. So can you tell us a little bit about your early years? Who inspired you to be a doctor? How did you decide that you wanted to be a doctor?
I always say that it started way back when I was in maybe 10th or 11th grade of high school. And my dentist, for all people, said, do you want to work in the Pittsburgh hospital? It was right up the street from his office. I can get you a job there. Well, I didn't really care whether it was the Pittsburgh hospital or the Winkies down the street. I just needed a summer job. So I said, sure. I got placed in the administrator's office. And I don't know why, sitting at my desk in the administrator's foreroom, all these doctors would come in, to have meetings with the administrator. The administrator was a woman, but none of the doctors were women. They were all male. They all had these long white coats on, and they were all white, actually, at that time. This was in Pittsburgh. I looked at those men coming in and out, acting like masters of the universe. And I said, I can do that. I always liked science, but I thought I was going to be a social worker. So I walked out of that experience determined to become a doctor. Fortunately, I was just in the nick of time to change my focus and head to college, and knowing that I was going to medical school.
Well, that's very interesting. One summer job experience changed the track of your life.
Mentorship. I had no exposure and no experience in medicine other than to go to the doctors. So mentors can make a huge amount of difference. His interest in me gave me an interest in something I didn't, a world I didn't know anything about.
Yeah. So you went to college, you went to medical school. How did urology come about?
Well, and I know it's all different now, but in medical school back then, we had these, we still have blocks. We had these blocks, and we had the nephrology, urology, renal block. And the nephrologist, I thought, was the best thing ever. I said, that's it. I want to be a nephrologist. Just knowing about the physiology of the kidney and how it functioned, just thought it was great. And then that next year, or the next semester, whatever, we rotated on rotations. We had urology, we had surgery, we had medicine, typical. When I got to the nephrology rotation and realized it was dialysis and talking with patients, I was just bored to death. I don't really want to do this. But I still like the kidney and renal physiology and that kind of stuff. I got in urology and I got to do things and I got to be somewhere and it was just exhilarating. And that's when I decided I'd be a urologist. So that must have been my third year of medical school.
That reminds me, somebody once asked me, what is your favorite operation? And I haven't done this for decades, but kidney surgery was my most favorite type of operation.
Love,
yeah, exactly. And the kidney and what it does and what you can do with it.
See? We're like-minded.
Exactly. So you ended up in urology, and I myself remember reading your articles on electroejaculation. I know many people have asked you about this, but I wanted to just share with you that I was a spinal cord fellow at the Seattle VA in 1993, and I was reading your articles on electroejaculation, and I was so impressed with this clever application of an animal husbandry technique to humans, and it was part of urology too. And so how did you come across this area to pursue?
Mentors. When I was at University of Michigan, I have to say Jack Clopetus was a mentor of mine. But in terms of neuro-urology, it was Ed McGuire, who came to University of Michigan while I was still a resident, then became chief of urology, chair of the urology department. And just as I was just about second to the last year of my residency. And he was a neuro-urologist, and he knew this veterinarian who had told him about what he did with ejaculatory, function. And this was for fertility reasons for animals. So you have a rare stallion or a panda bear or whatever. You want to make sure they have children, they have progeny. So we started with very examples of the electrical stimulation of the vascular bed via a probe placed in the rectum and then electricity transmitted. And we started on rabbits, and it worked. We didn't make pregnancy, but we got ejaculate. And it was, poor quality, poor viability. But from there, we came down the line till we did our first series of humans after getting approval, of course.
You've sort of given credit to your mentors, and that's completely appropriate. But, for you, what were your thought processes on pursuing these not common fields and ideas for a woman? You went to urology, then you're pursuing the research in an area that urologists had really never gone to before. I recall plenty of people telling me, why are you doing this? And what was your motivation?
I love to love what I do. And I love that part. And when it came to working with spinal cord injury patients, to be able to give them something for all that they had lost, these men with, and families that wanted to have children. So it's part emotional and part, there's nothing better than birthing a baby. I didn't know that. Not that I've delivered the children, but I knew that I was part of their life. I still, to this day, that was 30 years ago, 40 years ago, almost. I still get Christmas cards from some of them, for some of the parents. The kids are all grown up now. And so it was part of that human touch. In part because I thought this is something that's never been done before. If we can do it safely and if we can do it appropriately, we've done something for humanity. It can be science. It doesn't have to be, because urologists back then were almost a joke to a lot of people. Everybody would snicker and they would say the same thing to me. Why do you want to be a urologist? Who would ever want to be a urologist? What does a girl want to be a urologist for? And the answer is I enjoyed it. I loved it. It was fascinating. It still is.
Along those lines, my scientific mentor was a man named William Bradley, and he invented the AUS and the inflatable penile prosthesis. And he was a contemporary of Ed McGuire. And he said, you you urologists don't really take research seriously like other people do. And I heard that and I was like, yeah, we do. And I'm going to prove you.
Yeah.
Yes. And so it's interesting. It's fun. And there are so many problems that are worth
Find your niche.
exactly thinking about and making people's lives better.
If you can do one thing, one small thing, and do it well, and you could be an expert in that worldwide. You could be associated with that, whatever it is, little piece of nugget of interest you have. I don't know if that's true for all of medicine, but it certainly is true for urology.
Yeah, exactly. Well, we share another common interest, which is spinal cord injury. I've been at the Seattle VA since 1993. Their urologist. You got into spinal cord medicine early. Along with your developments in electroejaculation, what developments in spinal cord urology have you seen over the years?
Well, the thing that made me interested in spinal cord injury urology is the surgeries that we did. Some of them that aren't, like the Coke pouch is not done anymore, but it was terrific surgical experience, and to make a patient that can't void in some way, give them the ability to void, is really gratifying. So I would say that's really why I enjoyed spinal cord injury. And we're still trying to, on the physiatry side, they're trying to help them to walk. We're trying to help their bladder function better. We're trying to preserve their kidneys. We're trying to give them functional erections. We're trying to give them happen to ejaculate. So all of that is just areas of research that are just interesting, and that you're helping somebody in the end.
There are many studies corroborate what many people say, that urologic issues are a huge quality of life factor for spinal cord patients, and maybe even more so than the compromise in mobility, because when, as you know, the urinary tract doesn't work, it impacts your social life. It impacts
Intimacy.
So many things. Yes, exactly.
The feeling of worthlessness.
Yep.
If I smell all the time because I'm leaking all the time, I can't go out. I won't go to dinner. I'll be a shut-in. I won't interact with the world. So it's a very interesting, enjoyable area of study.
Yep. And these patients, at least nowadays, there are not so many surgical procedures, associated with their care. And so I don't think it's as popular, if you want to say that, or appealing to be urologists, caring for that population. But I certainly think that it's extremely gratifying too, just like you do. I was wondering, you've been a first throughout your career in many positions, and as mentioned earlier, the first African-American woman to train at Michigan, to be certified by the American Board of Urology, the first woman faculty at a number of institutions, urology departments. For you, has that been a motivation or a burden or neither?
Neither, because I never thought of it until somebody told me that. In fact, it was one of my residents that came up to me and said, Dr. Bennett, do you know you're the first African-American female urologist? I had no idea. I thought, that's a nice thing. Then everybody started saying it because she wrote an article about it. I said, nobody's going to care about that. How wrong was I?
I think it goes to this idea of mentorship. That's very dear to you, and see people, women of color in doing what you did is a form of mentorship. And so that's why people care about it. So, but, if it didn't occur to you, it just, I think, is a reflection of your humility. So, I think you were just doing what you thought you wanted and needed to do. So
that's exactly right. I followed my own North Star.
Yep. And along those same lines, Did you perceive any particular barriers during your career, either singular events or recurrent events? And what did you do to address that?
I think you can go through life seeing everything as a negative or everything as a positive, as most people do. And I tend to be Pollyanna-ish. So I realized it may not be, my experience may not be anybody else's. And they may interpret it differently. But the only one that really this very day that still burns when I think of it is when at University of Michigan, one of the attendings, I'm not going to say his name, but he was nasty, alcoholic, unhappy man. And he was a terrible surgeon. So he'd get in the OR and get in over his head. And then he'd start lashing out at not just me, but everybody. But he particularly had I felt an animus towards me. That was the only issue or time that I really felt I'm different. Short of that, the residents accepted me, and they were all guys at that time. The residents accepted me without a doubt. We became friends. I was friends with the one or two that were married with their wives. And the rest of us were just chums. And then shortly thereafter, by the time I was left Michigan, there were more women in the program, and there wasn't just one or two. I was the only African-American woman, but there were other women.
And in your different faculty positions, have you perceived barriers? And you don't have to call out anybody in particular, but just situations or...
Yeah, I had one situation at the VA. Everybody that was with me at the time knows it. And I felt that the way he reacted to me was particularly bothersome. And that issue went on. Since he was my superior, that issue, went on for quite a bit. Ultimately, everything resolved. I retained my position, and you don't have power at the VA. You work at a VA, so I retained my status, let's say, and things went back to normal. But it took a while. But I thought that particular interaction was based on me being a woman, a Black woman, demanding something that I thought we needed.
I think for me, when I was looking at surgical, subspecialties or surgery in general, to me, my perception, at least in medical school, was that urologists, even though they didn't have a lot of women amongst their ranks or people of color amongst their ranks, they were very, generally speaking,
genial group.
Yeah, exactly.
That's exactly right. That's why I don't think I ever thought about, I'm a woman, I'm a Black woman. I never thought of it that way because everybody was so welcoming. There are two notable exceptions in a 40-year career is not too bad.
Exactly. And I think the large number of women in a relatively, short period of time, a generation and a half, the explosion of women in urology is a reflection of the culture of, I guess, people who go into urology. And it's been welcoming. I've felt the same way as you have. And I'm just pleased that it is this way. We have colleagues in other specialties, I'm sure you do, I know I do, where it doesn't seem as welcoming, let's put it that way.
I believe it is not.
All righty. Well, for somebody who's practiced for a long time, for you, what's the biggest change that you have seen in clinical urology, just generally speaking, or maybe even a certain area of urology?
Well, of course, the growth explosion of male sexual function has become a science rather than a stab in the dark. Of course, the robot has made probably the biggest impact on urology and the way we manage surgical patients. Oh, well, I mean, my career is so ancient that when I started, we'd be using IVPs.
Yes.
Nobody even knows what that is anymore. I've never seen an IVP in 30 years. So, I mean, from IVPs to MRIs to, prostate ultrasound, all the way through to things I need to go to the science hall to see the next generation of tools that we can use. But that's fun. Urology tends to be fairly gadgety. So if you like gadgets, you can find something you want to do in urology.
I call them toys. I asked the first chair of urology at the University of Washington when he had retired, I said, the same question, what's the biggest change you've seen? And he said, what you said, imaging. imaging changed tremendously. And I'm like you, I trained on IVPs. And so when I look at a CT scan, my first view is a coronal view because that's the...
So you can orient yourself. Yeah.
Exactly. That's the one I start with. So
yeah. Okay, this is the left, this is the right, this is up, this is down.
Yes.
Now let's look at the films. And then the residents are like, all the way over here.
It's exactly.
They would glance at it,
Yeah. What are some trends or changes that you are excited about in urology?
Well, of course, women in urology. We had the adoption of AI. I think that's coming really fast in urology via robotics. I don't know what it's going to look like, but I'm sure that'll be the next big evolution.
I think women in medicine is a really good thing, where some ways, I don't want to say nurturing, and that's not the right word, but what women bring to the table for medicine, I think, is a good thing. And there's plenty of room for men and women, and having equal representation is certainly going to
Make the
be,
difference.
it's a good thing.
When I started, since I was the only one, I didn't appreciate that as much as I do now in retrospect. It was lonely going to a AUA meeting and there'd be one or two other women there. Maybe you run into them in the hallway. And now, as I said, look and go to AUA, 50% of the participants, speakers, the doers, are women. I think we just like doing a good job.
Yeah. I remember there was an AUA maybe 20 years ago, and I brought my 5-year-old daughter at the time. She was 5 at the time. And that was a time we could walk around in the hall where all the booths are. And she said to me, "Mommy, is this a meeting for men?"
What? And you said, "Pretty much."
I said, "It sure looks that way, doesn't it?" And so
even she noticed.
Exactly. And I think that's definitely different now, and it's a good thing. And
a good thing.
Yeah.
Yeah. That just brings back those feelings. You go to the meeting and you'd be the only woman, and you could find for miles.
Well, the good thing about that was that the women's bathroom was never
I used to say
full.
that. That's how I used to say that. Now you can't get into the women's bathroom. Back then, the men were standing around waiting, and we were just lost. You have a whole bathroom, 10 stalls to yourself.
Exactly. Yeah.
And the cleaning lady.
Yeah. Any advice you'd give to young people coming up in urology, not just women, men and women?
Well, enjoy it. I really think that's important. Perseverance is important. If you don't get what you want or you need, or you for the patient or for your education or whatever, stay at it. Don't give up. Work hard, because you don't get that opportunity as a resident or even junior faculty as you go up the ranks. You have a job to do. You get in a lane, and you don't get to do experimenting outside of that area that you're defined or known in or whatever. So while you have the chance, sample everything, try it all.
We hear a lot these days in academic environments about medical training and work-life balance. And I know when you and I were coming up, that definitely wasn't something to talk about. And this idea of just working hard and just doing a lot of work is, how we're kind of programmed. And I know that I have difficulty trying to reconcile how to counsel young people and this work-life balance kind of thing, because I don't think I had it, and I still don't think I have it where it would, look like balance, but it doesn't seem to be a problem for me. And I'm just wondering, what are your thoughts about that too?
I have to be honest. I was lucky that my husband, Keith, is Black is his name, is a neurosurgeon. He's, so we had the economic ability to hire in mommy and me, basically. Yeah. So I could stay at the office as long as I needed to, or in the hospital as long as I wanted to. and take care of things and not worry about the children at home. And the fact that I wanted to be with my children was a different issue. So I was able to do that. On weekends, I devote to them, and the week was for work. Is how I did it. May not work for everybody, but it worked for us. And my husband lived in the hospital, still does, all these years later. So I had to kind of figure it out. But now I think a lot of marriages or a lot of relationships is the partnership between the husband and the wife, and they split the duties. Well, I split mine with a nanny and a housekeeper.
Yeah, it's a different equation for everybody, that work-life balance. But if you love what you do,
and you love your children. It's not like you love them any less. I would often, almost invariably, get home by bedtime, bath time, reading stories. That was important, that I could do that with my children. So most nights I did that. But if I couldn't do it, I didn't have to worry about the babysitter's going to leave, because in Los Angeles, to have two working couples, you might have somebody that lives in or lives close, or family member, mother, or somebody that takes care of the child.
Exactly. It takes a village.
Takes a village. It takes a village.
Yeah. However that village is put together. So
yeah, as long as it works for you.
Yeah. All righty. Well, we focused on your professional life, which is kind of a serious topic. But to finish up, tell us something funny about yourself.
There's nothing funny about me. I'm not a funny person. I like to think I can sing, and I can barely talk. Let us sing.
Well, we'll have to catch you at karaoke sometime.
Yeah, karaoke. Yeah. I'm your girl if you want to go to karaoke.
All right. Well, Dr. Carol Bennett, congratulations on a long and successful career, which is still continuing. You have been and continue to be an inspiration to your trainees, colleagues, and patients. Congratulations, too, for all your accolades. They are well-deserved, and there are likely more to come. It's been a pleasure for me to spend time with you, and I'm sure podcast listeners will feel the same. Thank you for being here, and stay safe.
Thank you so much. I had a great time. You're a good interviewer, Claire.
Thank you so much for listening. If you haven't already, make sure to subscribe, rate the podcast 5 stars, and share with a friend.
If you have any questions or comments, DM us at _BackTable on Instagram, LinkedIn, or Twitter.
BackTable is hosted by Aditya Bagrodia
and Jose Silva.
Our audio team is led by Kieran Gannon, with support from
Josh McWhirter,
Aaron Bowles,
Josh Spencer.
Design and digital marketing led by Brian Schmitz.
Social media and PR by Chi Ding.
Administrative support provided by Jamila Kennebrew.
Thanks again for listening, and see you next week.